Yes. Well, thank you all so much for having me. So we are going to talk about, I'm going to hop right in, just communication and care quality, and really how can we enhance the patient's experience. So our objectives today, we're going to talk about really how to communicate confidently and professionally about uncomfortable and traumatic health situations to help us cultivate those trusting relationships, how to uniquely provide information and answer questions about traumatic birth experiences, and how to normalize and validate and refer clients to maternal mental health resources and support services that are here in the area. So a little bit more about me and why I'm sharing here today. Obviously, I have a online platform and nonprofit that really focuses on perinatal loss and bereavement, but I also am approaching this work as someone who's experienced loss, experienced birth trauma, and it is my goal, and I always say that my birth story really has inspired the work that I do and the work that I continue to do. But really, I want to make sure people have some clarity and peace, especially if they've gone through traumatic birth experiences like perinatal loss, and beyond. So I do want to start sharing a little bit about my story and kind of what inspired me to really have this conversation with you all, because as someone who is a patient advocate, but also who has had the lived experience, can give you perspective on how communication and the quality of care is impactful in the work that you do. So my journey to parenthood and motherhood started with losing two babies. I lost a son at birth he was full term. He was 39 weeks pregnant, and lost him due to complications from preeclampsia, high blood pressure, and he had some overdeveloped lungs, which is what we found out in the autopsy. So that's a picture of me holding him. It's my way of honoring my babies here, by showing you a couple pictures of them. So that's me holding him at the top. And then the bottom left is a picture of Now I Lay Me Down to Sleep, which is a national nonprofit that offers birth photography for babies who have passed away, bereavement photography. So they did bereavement photography for my son, as well as my daughter. So I ended up getting pregnant again, and I lost her at 18 weeks due to cervical insufficiency. And she was less than a pound when she was born. And that's a picture of her feet that is in that bottom right picture. So both amazing pictures, memories that I have had forever and will never get back that time. So I'm grateful for the quality of care that I received during that time, and that was an offering at the hospital that I was at. I did get pregnant again. I do have a son, a miracle baby. I ended up getting a cerclage placed at 19 weeks with this pregnancy to, hold the weight of my baby, a traditional cerclage. I did have a full placenta abruption. So I was hemorrhaging, I was bleeding internally. I ended up having to get about 9 blood transfusions to save my life. Literally, the doctors had to give me a emergency cesarean hysterectomy. So I was 28 and I became infertile, but obviously on the other side, I'm here as a witness, standing to a lot of the statistics around hemorrhaging and morbidity. But as a result of that, my son was born not breathing, had to be resuscitated at birth. He did have a brain injury, and he does have the more severe form of cerebral palsy. So, and he is 10 years old, turned 10 last month. So it's been a blessing, but obviously still navigating the healthcare system as a mother, especially to a child with complex medical needs. But so I share all that with you to say is that my birth story really inspired the work that I do, and it inspired the conversation that we're going to have today around how to make sure that we are having that quality care with our patients, especially if they experience some form of birth trauma in their childbirth and perinatal experience. So Sisters in Loss, our mission really is to help Black women replace silence with storytelling. It started as a podcast and obviously has grown into a consultant company and policy advocacy agency where we really talk about reproductive rights and justice and health equity. But it still is a podcast, something that I do get people who email me all the often about the impactful ways of storytelling, especially in the perinatal loss space. So it's obviously US based, but we do stream it all over the world, and we do have guests from all over the world. And we cover a variety of topics on the podcast, obviously focused a lot on diagnosis that you see more in Black women, Black birthing people, particularly in the United States. But we really do talk a lot about birth trauma and how a lot of Black women and birthing people may not be seen, may not be heard, may not be valued or respected in some of those birthing spaces. And it may lead to additional trauma, but also may lead to loss depending on the circumstance. So definitely a great resource to put in your toolbox, especially if you have clients or come across patients who want to have an outlet and want to hear other stories that are positive, as well as some that are in the middle road of their journey to parenthood. So obviously, I'm sure that you all know that most people, 1 in 3 birthing people report feeling traumatized by their birth and childbirth experience. And then 1 in 5 typically report they've experienced some form of mistreatment during their pregnancy or childbirth. And these are all statistics that came straight from the CDC. I like this quote from Peter Levine that says that trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering. Mainly because, as you all know, just like with grief, that we all are going to experience in some form, trauma also shows up based on our own experiences. So we want to make sure that we are empathetic, we are compassionate, that we are engaging with those strong emotions that not only we feel, but also our patients, our clients are feeling. And we really think about it as this one person's experience, even though it may differ from how you feel about the experience or situation or what the event that may be occurring. So I want to define birth trauma for you all. Birth trauma is, or a traumatic birth experience, refers to the birthing person's experiences of interactions and or events directly related to childbirth that cause overwhelming and distressing emotions, leading to short and or long-term impacts on the birthing person's health, well-being, and relationships. So birth trauma can show up, obviously immediately after birth, no different than any other perinatal mood and anxiety disorders that may come up in that postpartum experience. But it also can be something that happens, a year or two down the line, especially if they're recounting their birth experience, or maybe revisiting some of the areas that they were in, or maybe they, end up having a subsequent pregnancy, and this trauma can be sparked and come up, and it can affect their entire lives in so many different ways. It basically overall describes the symptoms that are related to the trauma of the birth itself, or just all of the circumstances surrounding the birth. But, trauma is known to be a big word that doesn't resonate with everyone. And what we really need to know and mean is that, if someone feels intensely afraid, fearful, out of control, helpless, I like to use the word powerlessness when they were actually giving birth, when they were pregnant, trying to get pregnant, or after they had their baby, that encompasses all of the trauma that they may have experienced. And to be honest with you, as a person who's experienced trauma, obviously through loss, through having a traumatic birth experience with my son, it leaves a lasting imprint in your mind mentally. And it can physically impact you as well. As I always like to say, The Body Keeps Score, which is a great novel, a great book also to read, but it also can impact you physically on how you physically show up in these spaces where, you may have patients who, when they come into your your office that their blood pressure is elevated because of the trauma that they've experienced. So that is a way that it may show up and manifest in individuals. Something else that I want to make sure we highlight is that this is just, that's a lot, the birth trauma could be for the actual birthing person or the woman who's experiencing, but it also could be very much so collective, individually for that person, but also collectively for the family, for their partners, and overall how those psychological reactions play a role together, and they really affect the entire society as just this confusion and distress that may be happening in their life. So for those who do experience some type of traumatic event or around the circumstances around their birth, their pregnancy, birth, or postpartum experience, they are at a higher risk factor for some form of perinatal mood and anxiety disorder, particularly PTSD, post-traumatic stress disorder. And a lot of this could factor into underlying traumas that they've already had in life, like, sexual abuse, or, maybe they identify differently and are part of a different community sexually, having a history already of mental illness or substance abuse. All of that plays a role into how people show up in these birthing spaces, and then how we should treat people in these birthing spaces as well, because everyone comes to in these spaces with various experiences, but it also are just other risk factors that are underground, underlying to how they show up, but also how they react as well, and what they may consider to be a traumatic event for them because of their underlying stressors. Some of the trauma that are associated with birth or even loss could be historical trauma of the hospital. I know that you all may not know this, but there are hospitals in the area that, as a doula, as a birth companion, as a bereavement support person, that a lot of people don't like to birth at, because of the historical trauma from generation word to mouth passing down. And I would even go down to historical trauma within the hospital system, within certain doctor systems, doctor OB/GYN offices. There is a lot of things that are there that can play into the environmental stressors that are there, the systemic stressors that may be there that hospitals are known for. And then that can play into a lot of the stressors of the traumatic events that people experience. It can manifest itself through panic attacks, just the poor treatment that people are receiving, nightmares, anxiety. Like I said, all of these risk factors play a role into some form of perinatal mood and anxiety disorder that would need to be formally diagnosed by a licensed mental health professional. But it's ways people can show up in these spaces, especially when they're thinking about all of the events that took place in their pregnancy, birth, or postpartum experience. So, but what we need to know is we need each other. There's no way for us to do this work, to continue to carry out quality care, to continue to ensure that we are helping to reduce a lot of these comorbidities, these rates, these statistics that are out there around mortality, morbidity for infants and mothers and maternal. But we need each other to be able to continue to move forward with it. So let's talk about communication after people have experienced trauma. In 9 out of 10 cases of birth trauma, they have reported to experience some poor communication. And poor communication meaning that the individual may not have been clear on exactly what was communicated to them, or maybe it was omitted from them. It was refrained from them based off of their mental state at the time. So having those interpersonal skills are critical in birth trauma prevention, because language matters, but also nonverbal communication matters just as equally. So often on Sisters in Loss in our grief support groups, as well as the folks that I interview on the podcast, they always talk about stories where patients and parents can really pinpoint the actual hotspot of their trauma as to something that was as seemingly as small as like someone rolling their eyes, tutting, smacking their lips, or just discarding them and how they feel in those situations. So think about how we carry ourselves, how people present themselves to us, and any other things that may be going on in your day to day when you come and you meet with patients in your bedside with clients, that those small little gestures can play a role in how people perceive the situation that they're in, but any other things that happen to that can add to what they may consider trauma. Language can also cause harm. As equally as important, language can create healing. So we want to make sure that we are creating a healthcare system that understands this potential path to healing, but also we understand how we show up in these spaces as well. We want to make sure that we're recognizing the signs and symptoms of trauma in our staff and clients and others involved with the system as we are carrying many loads. And then everyone really is fully integrated in the knowledge about the policies, the procedures, the practices, any tools that are available in the settings. And we are doing what we should to make sure that we are not actively re-traumatizing these individuals, especially after they've gone through such traumatic events like birth trauma or any type of loss that they may have experienced. So we all work in these high stress environments. We know this. It's always, what's the next patient? What's the what's the next protocol? What's the next policy or process that we are moving forward and moving after? So it is easy that a lot of the stressors that we're dealing with on a day-to-day may lead to some form of compassion fatigue that happens. And that's what I like to call it, is compassion fatigue. It typically kicks in probably around, those last 2 or 3 hours of a shift. And sometimes the attention to the details as we interact with people just become lost, and we become short because we know maybe we're having a bad day, maybe we're experiencing our own stresses of life, and it plays a role in how we address people around us. So I would love for us to just think about and reflect on not only how the stressors that we're dealing with on a day-to-day basis affects not only our own personal mental health and physical health, but it also impacts those that we come in contact with. So think about your words, the words that you use, the impact of the words that you use, but how, sometimes taking that extra step, that extra breath, going the extra mile is just that's the simple solution to reducing someone's trauma from a birthing experience. So how do we communicate with patients? So many ways, and I think that you all are already doing this, but it's something to just think about as we are talking to individuals. Um, and my own personal journey to motherhood and experiencing the losses I had, for them to come to me and share that my baby had passed away, or that I lost my uterus and I had to get a hysterectomy, a lot of that came with those doctors, those nurses, those therapists being honest with me about what I was experiencing. They were very empathetic. They knew what language to use, or they understood that maybe they didn't need to use filler words in the silent moments, right? They respected my boundaries. They validated my feelings. They were slow in ensuring that I understood what was happening. They gave me options, but they also gave me presence. I don't really always remember what people said. I will quote Maya Angelou on this. I don't remember what people actually did, but I always remember how people made me feel, as well as the people who showed up in those spaces. So we want to make sure that you are thinking about not only the words that you use, but actually how your physical presence is with those individuals, especially after they've gone through such a traumatic experience. Language is extremely important. you want to be aware of the language you use, determine if the patient is present there, or present at all, are they just not really understanding what's happening? You want to be curious with them. You want to get eye level with the mother, the birthing person, their partners, rather than like looming over them as like a power structure. You want to be specific with them, stating the details of exactly what's happened or what's occurring or what the options are. You want to be clear. You want to give clear facial expressions and body presence that's showing, nearest, that's showing compassion and curiosity. You want to listen to their response. And then you want to be ready to repeat it. Repeat the options, repeat the news, be ready to give them time to process it all. So I like to say that with our care quality and communication, we want to make sure that we are thinking about it as well as far as language, but also thinking about it with compassion as well as recognition of their feelings, like we're validating their feelings. So a way would be like, it sounds like you're really worried or you're really concerned. That makes sense to me. Like, you understand, you are validating them, you are regurgitating them exactly what they say to you, said back to you. And you're actually demonstrating belief in the individual. You're helping them really assess their safety, especially if they feel powerless or they feel that they can't trust their bodies or that this experience was out of their control. This is a great opportunity to build trust and rapport with the patient and the client. The other thing is to make sure that we are fostering that collaboration with individuals, that we are understanding the impact of the trauma that can be experienced through the sense of powerlessness. But we also acknowledge that as the healthcare professional, as the healthcare provider, as the clinicians, the therapists, you are always in the position of power. So regarding how people treat you, they're going to always look to you as the professional. And I want you all to reflect and think about how that could minimize the impact of the individual, especially if they are feeling this sense of powerlessness and they aren't trusting their body or this process or what the options that were provided to them that are available. Lastly, we want to make sure that we are consistent and we have this continuity in our communication protocols. We think about how are we facilitating these experiences with those who have experienced traumatic events in their perinatal period, because I wouldn't just say it's through birth, it could be throughout the whole perinatal period and onward. Do they really feel supported in each of these stages of their care? And then how can we make sure that we are consistently sharing information and best practices between staff and services to make sure that this cross communication is happening? A great example of this in my personal care and what I've heard from other clients that I've had is, say someone has experienced a birth trauma and they show up to their 6-8 week appointment after they've given birth, having the OBGYN and the nurse, schedule extra time on the schedule. So when the OBGYN sees them, they actually can sit and talk about their birth trauma, their birth experience. And if it was traumatic, that they talk about it in detail in that period. So, and then the OBGYN then coordinating with a maternal mental health therapist so that person can talk through it in therapy. So that's a way of connecting these services so that this care is coordinated and consistent, especially for those who are having hard times navigating through their birth experience, through their postpartum experience, and they just need the extra support. Something else that we want to make sure that we're doing is recognizing diversity and facilitating recovery. So every individual is shaped by their own experiences, and everyone will be unique in their understanding of and the responses of trauma in their lives. Some people come with various experiences, and I think that's the reason why we love having diverse experiences, diversity of thought. But with that, that means also they already have these underlying traumas that are happening for them. I mentioned before, folks who've had prior abuses, those who fall in the LGBTQIA population, they have other history of trauma that they're going to bring to these experiences. So we need to work to understand what it is, what's helpful, what's not helpful. And we want to make sure that these individuals who come with underlying trauma, underlying risk factors, we want to make sure that they are feeling empowered and really in control of their care and the options related to their care. One of the sisters-in-law said that it's the little things that sometimes make the biggest difference. And I wanted to make sure I left that quote in here for you all. The littlest things make the biggest difference. So I want you all to think about developing some resources for your practice, for your clinic, for your office that look like what are those maternal mental health support lists that you can offer that has a list of therapists that are licensed in the area that really focus on birth trauma or perinatal mood and anxiety disorders. That there are support groups in the area as well that could be virtual or in person that really support people who have experienced birth trauma. Think about a communication protocol. What could that be like? It could be helpful for providers to make sure they consider how we are having those pathway of services for those who are experienced by those who had a prior pregnancy-related trauma, and then having possible staff walk through a survivor's experience to get like, what does that look like for you to get an appointment, parking, signage, signing at the reception area, sitting in the waiting room, finding the bathroom. How is that whole communication protocol when someone experiences trauma and they're coming back in the area, or even if they experience trauma in the hospital, what does that look like, and making sure that they're connected to those services, and what practices and protocols and tools that we have in place, or do we need to develop them? And then think about ongoing training on and trauma-informed care, where this is something that you do on an annual basis, where everyone is getting additional tools in their toolbox. How can we continue to improve service design and delivery around trauma-informed care? How do we engage with people with lived experiences, particularly in the networks that you're in? And then making sure that that is a part of the evaluation process, and that evaluation that's happening, those responses are gathered and presented in a way that helps change policies and practices and protocols within your institution. That would be extremely helpful to make sure that we understand, what the problem is and how to solve it, and making sure that we are continuing to improve our communication and quality of care overall. Some other questions to consider, what is your current communication protocol care in your work, especially for those who've experienced some form of birth trauma or traumatic birth events? And what maternal mental health groups or services are in your area that really support this work? What new partnerships can be formed or implemented based off of this? And that is all I have for you all. This is my contact information and email address. I do have a list of resources. Yeah, I did list all my resources that I used to put this presentation together, and I'll make sure that you all get a copy of it. But I want to turn it back over for you all for any questions, comments, or thoughts that you all have.
You can come up here. I see some hands up. Catherine, you are unmuted, so you can go ahead and.
Thank you. Yeah, thank you so much, Erica. This was a really wonderful talk. And my question is around how to protect oneself from the intensity of the emotions, especially if you're, hearing about the painful stories one after another. How do you protect yourself so that you can continue to do the work?
Such a good question, Catherine. I think that we all have to take a moment and recognize that we're going to grieve we're going to experience some of those strong emotions too, and that we're human just like they are. Um, I think the best way to make sure that we do that properly is to make sure that you have a strong support system around you, that you all have a place that you can go, not necessarily trauma dump on, but a place that you can go and share your thoughts and opinions. Having your own personal licensed mental health professional also helps to make sure that you aren't always taking in a lot of those traumatic birth stories and events, as it does happen to a lot of us. And it probably happens daily in some of these hospital systems, at least from my experience in the way I've been supporting clients and through bereavement, it does happen every day. So that's the way that I always recommend people do, is to make sure that they have a community that's supporting them emotionally, but they also have someone else they can pour into as a therapist to lean on, especially when those things get hard. But we all are going to grieve. We're all going to experience some strong emotions with it. It's a part of life. And if we aren't experiencing it, I don't think we're human, because we all are going to
Yeah,
experience
thank you. Yeah,
it.
I think that last part, I often wonder if I stop feeling that, then maybe it's time to stop doing the therapy. Thank you.
Absolutely.
Melissa, you can come off mute.
No, thank you so much, Erica. My name's Melissa Fries. I sit as the clinical person for this wonderful PQC, and all of the people that have engaged today are here because they are working for the mothers, birthing people in our community. I felt so moved by your experience. As a physician who does high-risk care, you are the lady who, I never want this to ever happen to you. And I feel like for many providers, one of the things that is a real challenge is that when we have someone who's gone through what you have, we have a sense of failure too. And it is not right to put that on the same plane as your grief. But what it does is it makes it so that it's harder to engage. It's harder to say, you're going to blame me. I, I, this wasn't what I wanted to have happen. And and that is one of the toughest things that makes communication so difficult. Have you had any of that experience in some of the people you've engaged with?
I have. I will say this from my personal experience, and then I'll share a couple experiences from others that I've worked with. I kept the same OBGYN through all of my experiences. I did also have a maternal fetal medicine specialist for my last pregnancy, but only because of exactly what you just shared is what my physician told me, my OBGYN. She was empathetic with me, just like you just shared, and was just like, hey, this is hard for me too, but you want to have a baby, we're going to make sure you have a baby. We're going to make sure that we get you to that finish line. We're going to make sure you get all the care. If you need to come in every week to get an ultrasound, we will do that. So that compassionate care is why I never changed providers, because she gave me the trust that she was going to help me get to that other side of my parenthood journey. But on the other side of it, I've seen a lot of patients, a lot of clients that I've had as a doula, and even just people who shared stories on the podcast where they have had adverse relationships with their professionals, to the point of litigation, right? They'll go legal with it based off of how they were treated and their experiences. And I think that's where it gets tough, and it gets very difficult for individuals, especially as a provider, to continue to give that empathetic care, especially when you have had such a tough experience with a client or a patient, and really it's hard to navigate. So I would say that those are probably not few and far in between now. It's probably not something that you're getting every time. So I always would just take the wins with those ones that just don't feel right, or maybe a bad experience for both people, both parties at hand. And just really continue to be empathetic and compassionate, especially if they come back to you. They're coming back to you for a reason. So hopefully that helps affirm you and validate the work that you're doing. And I appreciate you for sharing.
Thanks so much. That is, I think, really important. I value your insights.
We have a question in the chat from Lisa Gilmore. She's asking, how can perinatal health providers help women and their families engage in the decision-making process at every step in their journey, especially during a time of crisis and grieving?
I think the biggest way that you can help them throughout the perinatal experience is really engaging with them with their goals are throughout that decision process. I think what ends up happening for a lot of individuals is that they get bogged down on and kind of hyper focused on this one thing, and they don't even think about the options that are available for them. So helping engage with options that are there, to help them make informed decisions, giving them the risk and the benefits of whatever those options are. That also always helps guide people in a different direction, especially if they were stuck on one way and there's obviously other ways to do all of the work that we do. So that's really how I would encourage you all to do that, is to make sure people understand the options that are available to them. And when they are grieving, I think the best way to do that is to make sure you have some type of, which I really didn't talk about today, which is like a palliative care plan and protocol. So it's something that you're doing consistently every time when you have a client who's experienced loss in any trimester, I would say. I mean, obviously it's a little harder to do in the first trimester, but second and third trimester particularly. It's the reason why I have pictures of my babies. I didn't know that I needed those pictures. The hospital automatically did that. They didn't, it wasn't a consent thing of like, maybe it was, maybe they did say, hey, Erica, we're going to take pictures. And I said, yes. But at that time when I was grieving, I didn't know that I needed them. So having some protocol in place, I know there are a lot of organizations in the area that do like angel boxes and memory boxes and things of that nature. That also helps people really understand what decisions and what options are available for them, especially in their grieving process.
We have another question in the chat about experience interacting, if you have any experience in interacting with social work professionals during your journey, and what was your personal experience like?
I have in the hospital as well as out the hospital. I've worked with social workers. Always positive experiences. I think that social workers, particularly for some of my clients that are on Medicaid, have helped out a lot, because there's only but so much that you can do, particularly for me as a doula, there's only but so much I can do to help those clients. But having a social worker there to partner with you, I think that's really the whole point of all of this, right? We're all support services, we're working in our own functions, but we all have to partner together to make sure that we are not only meeting the patient's needs, but we're adequately communicating to them exactly what options are available to them, but also if they are experiencing any type of trauma, that we provide them those wraparound services like a social worker who may be licensed to do therapy or not, but at least they can connect them with other connective services that we may not even know of, that they know of, and have those resources available.
Does
Good
anyone
question.
have any other questions?
I have a question, Erica.
Sure, absolutely.
How can we ensure or encourage moms to share their stories, and how can providers create that space to make it safe?
Oh, I think it's the time. Um, I think having the time to, or taking that extra time, will allow people to open up. Very similar to what Melissa just said, and her expressing her her own grief and her own worry about what happened. Um, Sometimes just having an open-ended question also helps people to start to open up and have those open conversations, to share their stories and experiences. I always like to lead conversations asking them to share it from their perspective, especially if you're a provider and you were also in the room, but you also probably had another 8 or 9, I don't want to say 8 or 9, maybe not that many, maybe 5 births that night, right? So your perspective is focused on all the different births. So it may be just good just to have that open-ended question and conversation, and then making that extra time in the schedule to have that conversation with them so that they would open up and share. I also think that we really haven't collectively grieved COVID. And as a nation, touch is so important. And we're still very much so like, don't touch me. But I think sometimes you may need to actually re-engage pre-COVID, where we did used to hug and touch and have empathy in that manner. And that also may physically let the guard down for individuals where they're more open and willing to share. So some things to think about to add in your toolbox, but just creating that safe space for people. And sometimes you have to lean into your own empathy and share a little bit about yourself to do so. And that gets people to build that rapport, to build that trust, that honesty, and they'll make that makes that space for them to say, oh, okay, well, I see my professional in a different light. They are human like me. They don't have this overarching power. They're grieving as well. They feel these strong emotions as well. So those are some things that I think will help foster those conversations, and then giving them time to open up and develop, and then being open to what happens after that. I think that's the other part, because when you open that space, now you're going to open up the floodgates, and they may share a lot more than you probably are ready for. So you also have to be ready on the other side too. Once you create that space to say, okay, there may be tears, let me make sure I have tissue in the room, right? There may be some strong emotions, make sure I'm ready and prepared for that as well. And then you process it the way that you should, as you are, going through your own process of, winding down from the day.
Yeah. Melissa said touch is vital. We have to find ways to be together.
Oh, we do. I wish people would hug more, but people are very still pre-COVID, like COVID, like, I don't want to touch, but we need to. I think that's a way to, let people's guard down, especially when you want them to share their stories or share how they felt about their birth experience.
Yeah. I had one more question that I feel like could be helpful for the providers as well, but how can they effectively involve family members in the care process while also respecting the mother's trauma and history and her preferences?
Absolutely. Family is critical and family is important, especially if they were there. So they probably have their own sense of experience and some form of trauma from it as well. Really engaging family members really depends on the family. Everyone has different hierarchies that they go through. Every culture is different on how you really have to understand and maybe ask the birthing person, the woman, exactly how they want to integrate the family. Do they want their family to know their information? How, it really is about consent, this whole process of involving family. The other part, when it comes to support services, I typically think about just the birthing person and the partner. But if other people were in the room, you want to think about, okay, well, is there a support service available for like a grandmother or even younger children or older children that may be a part of the family, and linking them that way as well. But typically when we think about support services, we're really just thinking about just the birthing person and maybe their partner, and not necessarily all the other family dynamics that may go on. But every family is different and every family's needs are different. So I always think about just focusing on what can I make sure this birthing person's good? Can I make sure their partner's good? And then filling in the gaps there, especially if other people were there.
Thank you. Any other questions from anyone?
No, these are all great questions.
If you do have a question, you can raise your hand and we can take you off mute, or you can type in the chat as well. I don't think so.
No, I don't think anybody's trying to talk. unless you have more commentary.
Well, I don't think there are any more questions. Just as I think everyone else in the chat has mentioned, thank you, Erica, for sharing your story.
You're
Being
welcome.
so
Thank
open and
you.
vulnerable to how you got inspired to be where you are and do the work that you do. So thank you very much for today.
Absolutely. Thank you all.
Thank you, Erica.
Thank you, everyone, for participating and attending.
Yeah. Bye, Erica.
Bye, everybody. Thank you all.